Hi, my name is Kaylin Carls, and I'm a prenatal genetic counselor from New Jersey. I'm also a member of the bleeding disorder community as I have von Willebrand's disease. Today, I'll be presenting my team's research regarding the utilization and perceived value of genetic counselors within hemophilia treatment centers. Hemophilia treatment centers have been utilized for the comprehensive care of individuals with hereditary bleeding disorders in the United States since the early 1970s. These treatment centers are expected to adhere to specific standards and criteria as outlined in the National Hemophilia Foundation's guidelines, which defines expectations for core team members, extended team members, and services provided. These guidelines do state that genetic counseling is a required component of the hemophilia treatment center evaluation. However, this service is not required to be performed by a genetic counselor. Genetic counselors are medical professionals with specialized training in genetics and counseling skills. Within the bleeding disorder community, genetic counselors ensure patients are receiving appropriate genetic testing and accurate interpretation of results. They can also help patients and families understand their diagnosis and provide any support they may need. As the uptake of genetic testing increases, providers must be increasingly proficient in genetics in order to properly navigate the ever changing complexity of genetics, which can include things like test selection, interpretation of diagnostic testing, carrier testing, and prenatal testing, while optimally integrating nuanced inheritance implications and genetic test results into clinical care and management. In the context of hemophilia treatment centers, it has been suggested that regularly involving a genetic counselor in the comprehensive care of patients lessens this burden on other providers, while concurrently ensuring that patients receive appropriate genetic testing, accurate results interpretation, provision of risk information, and psychosocial support following a diagnosis of hereditary bleeding disorder. In order to gain insight into the current utilization and perception of genetic counselors within hemophilia treatment centers, this study assessed the provision of genetic counseling services, the involvement of genetic counselors, and the perceived value of genetic counselors among the hemophilia treatment centers in the United States. There are a few key points that I would like you all to take away from our research. The first being that our research identified a significant disparity in the provision of genetic counseling, creating an unequal access to genetics expertise. When genetic counselors are integrated, HTCs or hemophilia treatment centers endorse their high level of understanding of hereditary bleeding disorders, the unique and valuable services they provide, and support their inclusion as part of the HTC core team. Reducing inconsistencies in the provision of genetic counseling may also increase healthcare equity and optimize patient care.